Namaste, ladies and gentlemen. My name is Karen M, Senior Yoga Teacher, Yoga Therapist Trainer at Union Yoga Ayurveda Singapore. I will be the moderator for this hour. I would like to start by welcoming all our delegates and attendees participating from physical locations and various electronic channels on Zoom and Facebook Live. And a very special welcome to our patients and care professionals who are the very reason we are having this conference. It's a great pleasure for me to introduce Dr. Karen M Mustian, our guest speaker today, who is going to talk to us regarding the efficacy of yoga in complementing cancer treatment. This is a subject in which we should all be deeply interested because it's by embracing supportive care treatments that we can best ensure the well-being of cancer survivors. Dr. Mustian is director of the PEAK, Human Performance Clinical Lab at the University of Rochester Medical Center. She chairs the Cancer Fatigue Group of the Multinational Association of Supportive Care in Cancer. She also steers the Symptom Management and Quality of Life Committee at the National Cancer Institute. She has won awards from the National Institute of Health and the Society of Behavioral Medicine and has over 86 journal publications to her credit. Dr. Mustian has also contributed to several books on complementary treatments for cancer. Ladies and gentlemen, please join me in warmly welcoming our esteemed and accomplished guest speaker, Dr. Karen Mustian.
Good evening, everyone. I am really thrilled to be here with all of you. Here in the United States where I'm at, it's evening. For some of you, it may be morning or midday. I'm thrilled to be able to share with you some of the research that we've been conducting here in the United States on how to effectively use yoga as a supportive care treatment during your cancer experience. I'm going to be talking to you today particularly about results from two large randomized clinical trials that we've conducted here in the United States. And then I will also be summarizing some of our findings and giving some recommendations to help you through your cancer journey. The two randomized clinical trials that I will be talking about are described below. In our first trial, we recruited 410 cancer survivors from across the United States. We assessed many of their symptoms and side effects, and then we randomized them to receive our Yokas yoga intervention or their standard survivorship care. We measured the symptoms and side effects that we were interested in, again, after they received these interventions. In our second study, which we just recently completed, we also recruited 740 cancer survivors. And in this particular study, we examined the influence of our Yokas yoga intervention, and we compared it to a very rigorous survivorship health education program. And we also compared it to cognitive behavioral therapy for treating insomnia. I want to take a minute to explain the type of yoga that we did for our intervention. We worked with one of our yoga instructors here in the United States who is also a cancer survivor. And she helped us to create a yoga intervention that included two basic types of yoga, gentle hatha yoga and a restorative yoga. We included three different components, so asana, pranayama, and in addition, awareness or mindfulness exercises. Our yoga program lasted for approximately 4 weeks. And each week, our participants came to yoga for 75 minutes, 2 times a week. We also encouraged them to develop a home practice and do yoga at home on their own. In order to standardize the yoga intervention that we used, we worked with our yoga consultant and we created manuals, and we worked with our trained Yoga Alliance certified instructors here in the United States. We trained them to deliver our intervention, and we worked with standardized yoga manuals and DVDs. If you recall, I also mentioned in our second trial that we compared our yoga intervention to a standard survivorship health education program. The education program that we developed and compared against our yoga intervention was guided by the American Society of Clinical Oncology Survivorship Health Education recommendations. It included a series of educational modules that provide important information for survivors. And it also was conducted in a group format so that they could receive peer support from each other as well as from our allied health professionals. The types of things that were discussed in the survivorship health education program included their medical treatments and understanding them, as well as the necessary follow-ups, challenges that they might face in survivorship, how to manage their side effects and the importance of rehabilitation, healthy lifestyle, and support. This intervention also lasted for 4 weeks, and participants came to their group sessions 2 times a week, and they were encouraged to implement all the strategies they were learning at home on their own. We also standardized this particular intervention by utilizing licensed health educators and manuals and PowerPoints and slides. We also compared our yoga intervention to cognitive behavioral therapy for insomnia. Cognitive behavioral therapy for insomnia is the gold standard treatment for treating insomnia when you're not using pharmaceuticals in the United States. This is an educational program that teaches patients about sleep and the importance of good sleep. It teaches them about sleep hygiene and how to control stimuli that might keep you awake, and how to manage your tiredness during the day so that you actually can sleep at night. This also includes a cognitive behavioral therapy component where our participants are taught to think differently about their thoughts and their troubles with sleep and to view them more positively. This particular intervention lasted for 8 weeks, and the participants met 1 time a week for 90 minutes. They were also encouraged to implement these strategies at home. And again, we standardized it, and we used licensed cognitive behavioral therapy professionals here in the United States. Across both of our trials, we had wonderful compliance and adherence. The yoga participants attended, on average, 6 of the 8 face-to-face sessions. 86% of them attended more than 5 sessions. In our second trial, we looked at the number of participants who actually withdrew from the yoga intervention and compared it to the number of people who withdrew from the health education and the cognitive behavioral therapy interventions. We found that participants in the yoga intervention were more likely to remain in the study, and fewer withdrew compared to those in the other 2 intervention conditions. We also found that the cancer survivors reported finding yoga very useful in helping their insomnia, and that they would, in fact, recommend it to other cancer survivors. One of the main side effects of cancer treatments is insomnia. And this was the primary outcome that we were interested in looking at in both of our studies. What we found in our first study is that our yoga participants significantly improved their sleep quality. They also decreased the amount of time that they spent napping during the day, and they reduced the amount of sleep medication that they used compared to the individuals who were not using yoga. In our second trial, we found out that the effects of our Yogas yoga for improving insomnia were greater than the effects of the standard survivorship health education. Another side effect that cancer patients and survivors report frequently is fatigue. It can be very troubling and debilitating and make it very difficult to continue with your normal life activities, but it can also make it very difficult for you to continue with your treatments. We found that the participants in our trial who actually were in our yoga intervention reduced their fatigue by 41%, while the individuals who were in our standard care conditions actually increased their fatigue. In addition to looking at the effects of yoga on sleep and fatigue, we were interested in the relationships between yoga and its effect on sleep and fatigue, and how these two outcomes might affect each other. For example, we wanted to know whether or not yoga improved sleep, and that was the way that yoga actually improved fatigue. And what we found is that between 22 and 32% of the yoga effect on fatigue was caused because of its improvement on sleep, particularly by reducing the daytime naps that individuals would need to take. We were also interested in finding out how yoga might help cancer survivors improve their daily activities and quality of life. As some of you know, and many of you can imagine, it's very difficult when you are going through cancer and you have your treatments to do all the things that you need to do to take care of yourself each day. We found in our trial that our yoga intervention actually improved our survivors' ability to do all their normal daily activities. We also showed that it improved their overall quality of life. The types of daily activities that we looked at were general walking and physical activity, as well as other household and normal daily activities. We were also interested in understanding the relationships between how yoga might improve fatigue and whether or not that was part of the reason that we saw an improvement in quality of life. And our data actually showed us that 45% of the effect of yoga on quality of life was caused because we improve fatigue. So cancer comes with a wide variety of side effects, and we looked at many other side effects in our data. And I'm going to share some of the findings that we have on some of these additional side effects. We also found that our yoga improved anxiety and mood in our participants. For example, our yoga participants showed an 18% reduction in anxiety, while our control subjects showed a very small improvement after they finished their treatment. With respect to mood, our participants in yoga showed a 45% reduction in mood disturbances, while participants who were not doing yoga only showed a small 11% reduction. We also found in our trial that participants who utilized our yoga reduced their muscle aches. This is a particular problem often for women who have breast cancer who are receiving aromatase inhibitors and tamoxifen. In addition, these breast cancer survivors who receive aromatase inhibitors and tamoxifen also can experience general pain. And we found that those who participated in our yoga intervention actually showed a significant reduction in their general pain. Many times patients will complain of having memory difficulties, and sometimes we refer to this as chemo brain. Many of our participants obviously had undergone chemotherapy as well as radiation therapy, and they were struggling with memory difficulty. We found that those who participated in our yoga intervention had a reduction in their memory difficulty, so their memory actually improved. Another area that we looked at in terms of side effects, and I think you've heard it if you've been listening to some of the other talks, you might have heard about the importance of maintaining a healthy circadian rhythm. And this helps with multiple systems throughout the body. We looked at the effect of our yoga on circadian rhythms in this trial, and we actually found that those participating in yoga increased their activities levels, and they maintained their activity levels throughout the day. And that by doing this, it actually helped to synchronize their circadian rhythms. So when I think about a summary of our effects of what we've learned from both of these clinical trials, we see that yoga actually has a wide variety of benefits for cancer survivors. For example, in summary, we showed that our yoga yoga is effective for improving sleep quality and insomnia. It actually helped to reduce sleep medication use. It improved fatigue. It improved daily activities of living and quality of life. It improved anxiety and mood, as well as muscle aches, pain, memory, and circadian rhythms. So when we think about the take-home message that we can learn from these two large randomized clinical trials conducted here in the United States, what we suggest here to our participants in the Peak Human Performance Lab and in our Cancer Center is that they consider using yoga as an intervention, particularly gentle hatha yoga, as well as restorative yoga. Now, we combine both of these into the same sessions when we taught our participants, but often here in the United States, when they seek out a yoga class in our community, they may not find these two types of yoga offered together. So we encourage them to take a gentle hatha yoga class or a restorative yoga class as well. We also encourage that all of the components of yoga need to be incorporated. That includes the asana, the pranayama, as well as the mindfulness. Oftentimes, when we find yoga, sometimes we find that less emphasis is placed on the breathing exercises or the mindfulness, and much of the focus is on postures. But in our work, we find that the combination of all three of these is really important, and that yoga in its truest sense really needs to be a part of the practice. We also suggest, based on our data, that participants try to practice their yoga 60 to 75 minutes per session. And we also found that it's important to do the yoga at least 3 times a week. Our participants who did it fewer times a week did not achieve the same level of benefit. In addition, the intensity of the yoga can be low to moderate. For example, it does not have to be done in a heated room. It does not have to be done fast at a very vigorous pace. It can be done at a very slow, low to moderate pace. So some of the recommendations that we also have found and work with our cancer survivors here is we encourage our cancer survivors to say yes to yoga, but to choose wisely and to start gently and progress very slowly, and make sure that you practice safely. We suggest that you work with qualified yoga instructors and yoga therapists, and that you speak with your physicians and your doctors to be aware of any contraindications that you may have, so that you can also use appropriate props and make appropriate modifications for a safe and effective yoga practice. We also recommend that our oncologists and our medical providers provide information regarding the benefits of yoga for managing these cancer-related toxicities to our patients and survivors. And we work with our oncologists and medical providers here to refer our survivors to qualified yoga instructors who have special training and experience working with cancer survivors. And one of the things that's really important about research like this is to make sure that we understand it's not just a scientist like me who actually conducts these trials. There are a lot of allied health professionals, a lot of yoga instructors, and a lot of cancer survivors who contribute their time and effort to participate in these trials so that we can learn and we can bring this information to people all around the world, just like you, so that you can understand the scientific evidence behind yoga and why it's a great option for you as a cancer survivor to use as you go through your cancer trajectory. Thank you, and I would be happy to take any questions.
Thank you. Victoria, may I have your question, please?
Here I am. My question is twofold. It's about the probably the times of the pre-research. How difficult was it to recruit those patients for your clinical trials? How eager were they to participate in these assessments? For example, when they were told that there's an opportunity about taking this complementary yoga course. What was the initial reaction? And the second part of my question is, I know it's among your recommendations and in your partnerships with oncologists and medical professionals to promote this type of complementary therapy. But how eager are those medical professionals to do this? How much do they actually know about what type of yoga is suggested? Because as we spoke earlier, nowadays yoga is mostly professed as fitness and exercise technique.
So those are terrific questions. So let me first start by talking about what it was like to get patients or survivors enrolled in these trials. So our first randomized clinical trial that we conducted here in my group in the United States started in 2004. And in 2004 in the United States, there were not that many yoga studios in a lot of different cities around our country. It was very new. And I would say that we were probably among the first to bring yoga into some of these communities and to partner the yoga instructors with these oncology practices. So that was the first step that we had to do. As soon as we created those partnerships, though, and those oncology practices went into the community and started asking survivors if they would like to participate in our trial, we did not have any problem at all recruiting. The survivors were very excited to participate. And in fact, because we opened the trial and we had trained these instructors and created these partnerships, it actually gave them an opportunity to experience complementary and integrative medicine in a way that previously had not been available to them. So it was very hard to get set up in the beginning. But then once it was offered to the survivors, they enrolled without any difficulty. And as a matter of fact, we enrolled all 420 of those survivors in that study in about a year and a half, which is very fast for a large clinical trial of that magnitude. And we enrolled these participants in a wide variety of cities across the United States. So some of them were in large metropolitan areas like you might expect, New York City or, outside of San Francisco and California. But we also were able to create these partnerships in more rural areas like Wichita, Kansas, and Brevard, North Carolina. And these are small rural communities where we also could provide this access for survivors. In terms of the assessments, they did not mind doing the assessments. I think many of our participants were incredibly altruistic. And so not only were they seeking benefit for themselves potentially when they enrolled in this trial, but they really wanted to do this part in science to contribute so that we really could learn about the scientific evidence of yoga, because they wanted it to be elevated and credible, and they wanted correct information out there for others who would experience cancer after them. Our second trial that enrolled 720 participants also enrolled very quickly. We were able to complete the actual enrollment for that trial in about 2.5 years, and that's a very large number for a behavioral trial in a network like that. And can you remind me of your second question again?
The second part of the question was about the actual medical professionals from the conventional medicine part. How willing are they to promote this type of therapy?
So when I first started this work, I think very few oncologists and physicians actually knew, they didn't know what yoga was. And so by doing this trial and working with them, one of the first things that happened is they actually learned what yoga is. And they learned that it is very real and it's very credible, and that it does have benefits. The physicians who worked with us in our trials, many of them I'm still in touch with today. I see them at annual meetings regularly throughout the year, and they will tell me that they now recommend that their patients do yoga. I think one of the challenges that we face is that oftentimes our oncologists and our medical physicians don't feel like they know enough about the different types of yoga or specific yoga prescriptions or exactly how it should be done and how to do it safely. So one of the things that we encourage them to do is they do not have to feel like they themselves have to provide the yoga prescription. We encourage them to connect with certified yoga instructors and yoga therapists in their community and to learn about these resources in their community, and then to refer their patients to the yoga therapists and instructors the same way that you would refer a patient for surgery to a surgeon or a radiation oncologist for their radiation. And we find that that seems to be the best way, and then they're very comfortable with that once they find a credible referral in their community.
Okay, thank you. Thank you, Victoria, for your question. We'll move on to the next question here. BB.
Hello, doctor. My
Hello.
my name is BB. I have a question for you. Actually, I'm under the medication of tosimorphin. And I would like to ask you, you're talking about the insomnia. May I know how can I overcome this insomnia through yoga?
So what we found in our trial is that if you do even a few minutes of gentle yoga, and you do it at least 3 or more times a week, that it will actually improve your insomnia. And you might be able to take, if you take any medications for your insomnia to try and help you sleep, it might be able to help you take less of those sleep medications. The important part, I think, about doing the yoga is to integrate it as many days as you can during your week, and to find someone who can help you as an instructor learn those postures and to actually practice the yoga. It's going to be important to implement it, and really it has to be a practice of probably about 60 minutes or more a day is what our data is saying. If you could do that 3 times a week, I think you might find an improvement in your insomnia.
Thank you, doctor.
Doctor, related to the same question actually, what can be, in the sense when you talk about yoga, gentle yoga, so can you give us an example on which asanas or what kind of easy pranayama practices could be a part of a daily routine?
Sure. So even on a day when you're not feeling very well, you could simply do shavasana, and you could do breathing exercises in your shavasana and mindfulness while you're in your shavasana. We also find that very simple downward dog, it can be very useful. Warrior pose, for example, Supta Konasana. There's a wide variety of very basic, simple hatha yoga postures that can be helpful.
Thank you. We have a question from our FB Live. When the patients ask, when do we stop practicing, what should we reply? In the sense, when we come to modern medicine, we have a kind of a 6 months course or a 3 months course. So when they come to yoga for as a supportive care, so they sometimes ask, till how long should I practice this, or should I be doing it daily? Yes, of course, you have answered that. How long should it be, or should they practice it and get into a routine into their life?
So I think one of the things that you're going to find is that when you begin to practice yoga, you're going to see the benefits relatively quickly. In our study, our first study, we had our participants do the yoga for 4 weeks. And at the end of 4 weeks, we measured the change in their side effects. And that 4-week period, we saw all of the effects that I just described in my presentation. Now, does that mean you should stop at the end of 4 weeks? Probably not. One of the most important things about yoga is that it's really about a way of life, and really bringing this into your everyday life and your life activities. When you are diagnosed with cancer and you go through your treatments, you're going to be a survivor for the rest of your life. And so if you can bring that practice of yoga with you for the rest of your life, it's going to help you every day to thrive as a survivor and to maintain a very healthy recovery and go on with your life in amazing ways. So we encourage people to make it a way of life and to really integrate it. And there does not have to be an end. You do not have to stop. We would encourage you not to stop.
Thank you so much. The next question here is about all the parameters that you have stated in the presentation, like insomnia, fatigue, quality of life, anxiety, mood, pain, memory. All these parameters, is there any easy way for the patients themselves to assess? Like, is there a questionnaire or something which they can fill up, and then the assessment is easy to do from their side? Or even for the yoga therapist or yoga enthusiast who have people or loved ones among their family or friends. So is there any questionnaire that is readily there?
So you can actually make your own questionnaire. It's really simple if you're a patient. In our trials, what we do is we list the side effects on one of our questionnaires. We just list a variety of side effects. And we use a scale, 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 0 means you do not have that problem that day. So if I'm rating my fatigue and I give it a 0, it means I didn't really have any fatigue that day. I felt very good, very energized all day. And then you rate, if you do have fatigue, you rate it. 1 is a little, 2 is more, 5 is moderate, 10 is a level of fatigue that's really awful, as bad as you can imagine. And if you're doing yoga and you have a couple of these side effects that you are trying to monitor and see if the yoga is helping, you could simply write those side effects down and give them a rating each day between 0 and 10. And then you can look at that over a week or 2 weeks, a month, and you will be able to see how those symptoms track with your yoga. So for example, if you track your yoga and you track your symptoms, you may learn that on the days that you do the yoga, you feel better, and on the days that you don't do the yoga, your symptoms are going to be worse. So it's actually a very simple tracking. We use lots of other questionnaires in our research, but that's probably the simplest way that you can monitor these symptoms for yourself as you're doing your yoga.
Thank you very much. We have a question via chat here. Shri Purna asks, in the trials other than asana, pranayama and meditation, was their diet observed too?
So in our clinical trials, we did not measure diet. We were focused on measuring the symptoms and measuring the adherence to the yoga. Unfortunately, in a clinical trial, you can't measure everything, or it would be impossible for our participants to do everything. So we don't have detailed information on their diet.
Okay. My next question would be, how do we help patients bring their mind in control and to be positive? Is there something like yoga counseling? The questions comes from the fact that we had this Yoga for Cancer awareness program, and we were giving yoga protocols to the cancer patients, survivors and fighters. And we got to know that after the session, they want to talk, they want to be in touch, they want to be heard and have a good, how do I say, basically talk to their yoga person, yoga therapist. So is there something called yoga counseling which will help them in this case?
So in our trial, we did not do this type of yoga counseling that you're talking about. But one of the things we didn't do it formally, I should say. But one of the things that I do know happened is the participants would come to the classes and obviously they would talk to each other and they would talk to the instructor and they could ask questions before class, during class, after class. And one of the things that we did hear from our participants anecdotally and through our feedback questionnaires is that they did appreciate the bonding with their peers who were also going through the cancer experience at the same time, and that bonding was quite powerful. That's one of the things that we are going to be trying to follow up on in future research that I'm doing. I don't have data to know that whether or not many of them had long extended discussions with their yoga therapist afterwards. But I do know that they interacted with them shortly before class and after class, and they talked about the fact that that was very beneficial.
We have our next question here from Prashanti via Zoom chat. Was the yoga's treatment differentiated for patients at different stages of cancer and for different types of cancer? If yes, how was the therapy modified? Thank you.
So the majority of the patients that enrolled in our trials were breast cancer survivors, and they did not have advanced cancer. So they could have stage 0, 1, 2, and 3. And then we had a few lymphoma patients and a wide variety of other diagnoses. In this particular class, the yoga intervention was standardized. So we did the same asana repeatedly every day, but the modification was not based on the type of cancer that they had or the type of treatment that they had had previously. The way that we did our modifications was based on any particular individual needs that a participant might have. So for example, if a participant came and they were a breast cancer survivor, but maybe they also previously had a lower back injury, we would work with them to do modifications to be able to work with their lower back injury. And we actually found that was more important to work with the individual patient and all of these individual things that they bring to the table for their yoga practice, more so than to try and tailor it to the previous chemotherapy or radiation that they had. And I will say that these patients were not undergoing active treatment. So this yoga was not delivered during chemotherapy or during radiation. So any modifications that might need to be made during that time, we would want to take a look at that literature, but that's not what we did.
Thank you very much. I will move on to the next question, again from the Zoom chat. Siti. She asks, in the trials, what is the age range of patients' survival and how was the success or improvements observed for the different age group? Thank you.
So the average age of participants in our trial is in the mid to late 50s, so 55 to 57. And we did not find any differences in benefit based on a participant's age. So, our younger participants who might have been, say, in their late 30s or 40s, they had the same benefit as someone in their 50s. And we did have older patients who were in their 60s and 70s, and they also benefited from the yoga equally as well. We found no differences based on age.
Okay. We'll go on to the next one here. It's from Sandra. Was yoga done in groups or one-by-one session?
So all of our yoga was done in groups where the participants came to a class, and our classes were relatively small in number. They ranged from about 5 to maybe as high as 10, but usually they were somewhere between 5 and 7 participants in the class. So it wasn't a big yoga class like you might see in a fitness center. So there were not 30 people in the room doing yoga together. And I think that this gave the yoga instructor greater capacity to work with each of the individual patients in the group.
My next question is from Amisha. Is there any follow-up beyond 4 weeks of trial if the same good effects lasted?
So that's a terrific question. We just literally finished the trial with 720 people, and we presented the first findings just a few months ago in June at the American Society of Clinical Oncology, and we presented some of the outcomes for our 3 months and 6 months later. So this means that our participants did the yoga together for 4 weeks, and then they went away to do their self-practice on their own for the next 3 months, and then 6 months later. And basically we found that the effects of yoga on insomnia, which is what we've looked at so far in that trial, they last and they're durable. And in some instances, it looks like the effects got even stronger later at 3 months and 6 months. So I do believe that, and the patients are reporting that they did continue their practice during that time.
Okay. I can see a raised hand amongst the participant. Petra. Petra, can you unmute yourself?
Yes, thank you, Karen, and thank you, Dr. Mustian, for explaining interesting results of your clinical trials. You were mentioning something about improvement of the activity of the circadian profile. Could you maybe explain some more about that?
I'd be delighted to explain that. So you can measure circadian rhythm in many different ways. Oftentimes people will take a blood sample, for example, and they might measure your cortisol level or your melatonin level. You can also measure circadian rhythm by measuring a person's level of physical activity. We used devices called actigraphs, and our participants in our trials wore these actigraphs for 24-hour periods, 7 days in a row. And so they would do that at the beginning before they actually started the yoga intervention. So we would measure it for 7 days. Then they did the yoga intervention, and at the end, we again put the actigraph devices on them, and they wore them continuously for 7 days. Then we're able to, based on the data that we collect from the actigraph, it actually shows a person's movement patterns throughout an entire 24-hour period. And I know we often think of eating and sleeping and things like that as indicators of a circadian rhythm, but your movement pattern is also an indicator of your circadian rhythm. And so using the actigraph, we modeled that movement pattern, and we were able to model their circadian rhythm patterns. And what we saw is that the participants in the yoga group actually showed a more regulated circadian rhythm pattern than our participants who were not doing the yoga.
We have our next question from Barbara. Barbara, can you please unmute yourself?
Thank you. Good morning. I have a question. When you did all your research and you realized your patients already get benefit of yoga and can deal with it, have you the situation that something new of cancer findings like other metastases come out? And what happened to this patient? Were they able to react how do I say, a little bit more calm or to bear this new situation?
So let me see if I understand your question. So I think you're wanting to know if the patients participated in our yoga research, and then maybe they had a metastases of their cancer later, or they had a recurrence of their cancer.
Yes.
Were they able to deal with that better?
Yes, correct. Thank you.
So in the first trial, we didn't follow patients after our post-intervention assessment. So we have no information on that. In our current trial, we did follow them, as I said, for 6 months. But we have, again, that data is very fresh. We've only gotten a few of our outcomes analyzed. So you guys are hearing that information very, very early. We haven't been able to look at that yet. So I wouldn't be able to answer that question.
Okay. May I ask a second question, please? What happens, the patient come into your research, into your study? Did you realize then when you explain all the structure of the mind and all the knowledge what the mind is doing with our body and due to our lifestyle, did you feel it was important to explain everything first so that the patient knows why they are doing yoga and why is it more benefit, or it was not necessary because they felt it by their own?
So the way that we worked with our class, we did not explain everything first. We started them moving, and as they were moving and using their body, the instructors would explain the types of things that you're talking about. And I think as they were experiencing it and hearing it at the same time, that's the way that we did it, and it worked. It did not seem to overwhelm them. Mm-hmm. You know, I think it made it easier for them to understand it because they were experiencing it at the same time.
Okay, thank you very much. Very helpful.
There is one more question here, and have you noticed patients were unable to concentrate or being anxious or sort of depression? How were you able to manage it during a group study?
So our yoga instructors were phenomenal. We used very highly trained, well-trained yoga instructors. And as you can imagine, there would have been participants who would have had good days and bad days, certain days when they were more anxious or sad or depressed. It actually did not get in the way of them being able to do the yoga. What would happen is I think that they wanted to come and do the yoga because they were experiencing the relief from it while they were there in the yoga session. And so it actually encouraged them to come.
Thank you. Thank you. I think we are at the end of our session here. There's one last question, and it says, how do we encourage the survivors to say yes for yoga?
I think one of the most powerful things for a survivor to hear is another survivor's experience with it. And if another survivor has used yoga effectively as a tool to help them through their experience, the more that we can hear from survivors and patients who've done it and used it and it's worked for them, I think that's going to help other survivors say yes. So we definitely try to connect our participants with people who have done it, and actually we'll be able to talk to them about that experience. I think also demystifying yoga, just being willing to talk about it, being willing to try it and explain it and refer them to credible, well-trained instructors. I know sometimes the survivors here that I work with in my lab, even with basic exercises and things like that, they're often afraid to try it because they're worried they're going to hurt themselves. And what they come to us for is they want us to be able to say to them, this is a good thing for you to do, and here is a credible yoga therapist for you to work with, who knows how to work with cancer patients, who's not going to do anything, negligent that will be hurtful to you. So much in the same way that, if you're diagnosed with cancer and you need to find a radiation oncologist, you ask people who's the best radiation oncologist around to go to. We try in our cancer center to find good, credible yoga therapists to recommend them to. And that helps because they feel safe and they feel like they have someone who's knowledgeable to help them. So those two things, good qualified instructors and other patient testimonials.
Thank you. Thank you. Thank you very much, Dr. Karen Mustian, for sharing your experience and study with us. This brings to the end of our session today. And it was a wonderful session. And we'll be seeing you tomorrow for our panel discussion, Yoga for Cancer. Looking forward to it. Thank you all for joining in, and namaste. Have a beautiful, wonderful day.
Namaste.